sang this song to me. There was a message in its melody, sweetest lyrics that I ever heard. There's a message in the songs of birds. Tomorrow is another day. Living is the only way tomorrow's gonna ever come. Listen to the words of the song. Everything's gonna be alright. Everything is gonna be.
Good evening. I am Stephanie Wilson-Coleman, known as the Empowerment Doctor, and I want to welcome everyone who's watching this show now and who will watch this show in the future, because I guarantee it's going to be an absolutely fantastic show. So I want to just invite you to tonight's A Sip of Inspiration podcast, where we share information to inform and inspire others to improve their lives. Be sure you like our YouTube channel page that can be found by searching my name in YouTube, which is Stephanie Wilson-Coleman, and also like my Facebook page. Our show today is brought to you by Rise Industrial Supply and Equipment. When you need a supply company to rise to your needs, call Resource Industrial Supply and Equipment. The human body is an incredible piece of art. And our guest today, Enid Carter-Cutchins, will discuss how to help us to learn how to keep our bodies in good condition, so that can help us with what I call our fast and furious lives. You know, the play on the car show, Fast and Furious, because I think we treat our bodies like automobiles sometimes, and we don't always stop to take care of them. Enoch is uniquely Enid is uniquely trained in various modalities, which include massage therapy, visceral manipulation, and craniosacral therapy. And she's going to tell us what all that is. And I guarantee you're going to want some. Okay. You see, a healthy body is a great complement for the millionaire mindset. And we are all trying to develop the millionaire mindset. So before we get started, the information shared today is for informational purposes only and not intended to serve as medical advice. So hi, Enid. Thank you for joining us.
Hello.
Hi. And start off by telling us a little bit about you. See, I know all about Enid because she's famous in my world, okay?
I am Enid Carter-Cutchins. I am a licensed massage therapist in the state of Michigan. And I am the owner of Because Her Hands Care. And I am recently the owner of the Do Center. So that is the wellness center that I've just put together that has been a brainchild, signed the lease March 1st, 2020. And it's all right. I've learned that if God gives the vision, God gives the provision. And so I have expanded into this beautiful wellness space. I have been a massage therapist for the past 15 years or better. But I graduated in 2008. I also have an oncology certification. I did 100 hours here at the Beaumont Hospital for oncology therapy. I do lymphatic drainage, craniosacral therapy, visceral manipulation, reflexology, neuromuscular training, global joint treatment, and some other stuff.
As you said. And
It's all, yeah, it's all body work related. That's what I do all day. I love the body and I love to help people do what they love to do. So whether it's just lounging around the house or whether it's being the weekend warrior, whatever it is, I'm here for it. I support it. Once upon a time, when I was massage supervisor, one of my employees talked about how I walk into the room, be like, all your dreams become true. Here I am, it's coming true with massage. So it's kind of true about me.
so I could tell you all a little story. So I was doing a conference one year, and it was actually there at the conference, and just what she didn't know is I had this awful headache. Remember?
Yes.
And I mean, I had this headache for a long time. I was a guest speaker at a conference, and Enid attended the conference, and I had this terrible headache for like weeks and weeks, right? Nothing I did made it go away, but I knew I had to keep moving through. So I showed up, and then Enid said, "You know what? Can I just massage your hands for a minute?" Right? And she did. And guess what? My headache went away. So she's been one of my best friends ever since.
I know, I know. I snuck a little fascial mobilization in on you and traction that fascia. I was like, what is that? Like,
So, how did you get started?
oh my God, it's my God-given gift. They discovered it when I was 5 years old. The
Oh,
massage lady on the public access channel would come on after the yoga lady. And for some reason, when I was 5 years old, I was fascinated with the massage lady. I started massaging my mother's head, didn't even know what a migraine headache was, which she did have. And she kept falling asleep on me. And I figured she was just done playing with me. And she kept telling me to come back. And there you go. It was birth.
okay. So that's really cool. I know there are a lot of people who wish that they could connect to their gifts early like that. And I should say there are a lot of people who wish that they recognize that they have connected with their gifts, because sometimes we just don't connect with it, we dismiss it. But you didn't allow that to stop you. You kept on doing that.
Actually, it took years and years and years. I didn't know there. I really wanted to be a doctor. And later on, I looked into becoming a PT. I actually trained to become a PTA. And it didn't, nothing worked out. But when I went to massage school, it's like the whole world opened up and God was like, you're here. And I haven't regretted a minute of it. It's like my dream got handed to me on a platter. I went to massage school inside of Seattle Muscles and Motion, which is a musculoskeletal rehab. They did auto injury, traumatic brain injury, pain management, on top of doing on top of just doing regular massage. And it was just a magnificent experience to cut my teeth on those type of things, you know, which with traumatic brain injury and auto trauma. I also mastered with hardware and contractures and spinal cord. So I love this stuff.
So you've been doing this a long time, since you were 5, a long time.
But
So,
but graduated from massage school in 2008.
okay. So when you graduated in 2008, what type of work were you doing more regularly when you first graduated?
I was doing all of the above. Contractures. I was doing contractures, spinal cord injury, pain management, auto trauma. That I was already there. That was the thing. Body hardware. You know, that was it. When I graduated from massage school in 2008, I already had 2 craniosacral classes under my belt. 2 weeks after I graduated from massage school, I went to Seattle and started the visceral manipulation track. Probably about 2 months after that, I was into neuromuscular training, um, and I whipped through those classes. Um, I did a lot of my training in Chicago and Seattle, so I was whipping back and forth. Let's see, somewhere in there, I got a sports certification. Um, in 2000, it actually just came up in like 2010. Actually, it would be today, 2010, that I got my oncology cert. That was at Beaumont Hospital, 100 CEs, 48 hours in the classroom, 52. I was on the move, and I was here to help people. And for the oncology cert, lymphatic drainage and a whole lot of other stuff came.
Okay, so
So
let's
it's
like,
just blessed.
yeah, let's break this down, because you've been really busy. It's like nothing you haven't seen. It's like it's I bet you say, "Oh good, there's something else wrong with this body. Let me figure out how to fix that too." So,
It was just a lot of people to help. And, you know, thank God that I just fell in and I had the heart to help people. And I saw a whole lot of people that were getting looked over. You know, it was just the natural curiosity, like what's going on beyond the safe realm? You know, what's going on with these two upper vertebrae, C1 and C2? You know,
mhm.
and people needed help. And so I tend to specialize in underserved communities, and I volunteer a lot in underserved communities like the hemophilia community and the burn scar community.
So break it down to us. So what is the craniosacral therapy? What does that deal with? And how would someone know that they should be interested in that? So let's break this down. Because see, most people know about regular massages. They don't know about the rest. They just know get a regular
That's actually
massage.
body work. And
Okay.
so there's a difference between massage, body work, and energy work. Even though energy work, massage can still fall under body work and energy work.
Okay.
So that's the thing. So not all techniques are massage, even though you may be touching the body. So with craniosacral is a very, very soft touch therapy, and you use the weight of a 5 grams, and so that's about the weight of a nickel. And with that, your body starts its own healing process, and it works with your body's inner physician. So everybody's body has an inner wisdom. And so everybody thinks go harder, go harder, go harder. But if you just start even with just a 5 gram touch, the body will open up. And yes, you do work with different holes along the skulls and down the spine, and also the whole pelvis.
Okay, so what kinds of
That's
issues?
just the basic of that. It
Okay.
gets deeper.
I can imagine. So, and
It gets deeper.
I'm about to ask the strangest question ever, probably. So, what kind of symptoms would a person be experiencing that would lead them to need the craniosacral therapy?
Everybody needs craniosacral. Everybody.
Everybody.
Whether you know it or not, you need craniosacral. It is it's very soft touch. It's very gentle. It helps to move the cerebral spinal fluid around. It tractions the dural cord, the dural tube, the dural cord, the dura. I'm trying to like make this simple. So the dura is the sheath that is around the spinal cord, and so sometimes it can get bunched up, but just to traction it, and it just smooths out. And it is the craniosacral has lots of caveats in it. So it can also be like really soothing in a stressful world. So it is one of the most relaxing type of therapies. The only thing is some people are just looking for something dynamic and it's very subtle. So some people may walk out who are in tune with their bodies. They may walk out floating on air, and somebody else may be what has happened. And sometimes you feel the effects later, but it is just a wonderful integrative therapy.
Okay, so you recommend that therapy for everyone. So
everyone, pain management, everything.
Okay.
But it is great. It is a wonderful wellness therapy.
So what about visceral manipulation?
Another soft touch therapy that works with your nervous system. It is very subtle, and all the organs in our body, not only do they have most of them have ligaments, and so sometimes as our organs move, they get adhesions, and they can stick together. But doing this amazing dance where they're doing this and this the whole time, the organs are moving, and as they move amongst each other, they have specific pressure gradients for each of them, and we don't know it like through the course of surgery, injury, what else? Our emotions, our habits. So both craniosacral and visceral manipulation both work with emotionals, because we don't realize how much emotion that we're doing within our bodies, and each one of our organs also is correlated with the emotion, especially like when it talks to Chinese medicine. Dr. Upledger is the father of craniosacral therapy, as I know it. and from my training. And Dr. Baral is the father of visceral manipulation. And one thing Dr. Baral always says is the body hugs the lesions. And so a lot of times we'll be sitting in a different position and we'll be compensating, or it's just hard to get comfortable within your body, or in Chinese medicine, you start talking about the emotions, but also in Dr. Baral's theory, each of the organs has an emotion correlated with it. And he wrote a book called Understanding the Messages of Your Body.
Okay. And I know that even in some of the practices that I do, a lot of illnesses tie back to what's happening in not only your emotional state, but it happens, your body's trying to tell you something, and it can key you to what's going on in your mind. That's pretty
Right.
cool.
Pain is not your birthright, and pain is always a symptom.
Okay, I'm writing that down. Pain is not your birthright. Okay. So if you
Nope.
are having some pain, you need to do something. You need to go see about that. Okay.
Yes.
So what about neuromuscular training? So tell us a little bit about that, and then we'll talk about some others and your favorite, because you got to have a favorite.
Actually, neuromuscular training is one of my favorites.
Okay.
That is my go-to. It is a very detailed work, and it is very detailed muscle work. And all three of these therapies, craniosacral, neuromuscular training, and visceral manipulation, they're all brain body connected.
Oh, wow.
So neuromuscular training will work that muscle from origin to attachment.
Okay.
So that means from point to point.
And what is the oncology certification about? That's interesting too.
The oncology certification is a lot of work. Let's see, where do you start with that? 48 hours in the classroom. Not only are you learning about cancer treatment, different types of cancer, goodness, um, the when and when not to treat,
Oh, okay.
the indications and contraindications to go along with it, meaning contraindication means when not to touch. It is an important thing. Like some people want to be so aggressive, and also learning the post-operative care. And also with that oncology education, it was also hospital training. So we got to go through the hospital, antepartum, postpartum. We went in the actual suites, 52 hours. We were in the suites for, with doing dialysis, with giving massage to dialysis patients and the cancer patients who were actually getting infused with the chemo.
Oh, wow. That's all incredibly interesting. So,
Yeah,
so you use the neuromuscular, is that the one that you use most frequently?
I tend to blend.
Okay.
I am, what I do is more known as integrative therapy. So I blend everything in. Even though I can do a la carte, if I see that's what you need, that's what we're doing. And oh yeah, you want to talk about one of my favorites? I love doing intraoral work.
That's right. Let's talk about interoral.
I
We
will
talk a
stick
little
my
bit
fingers.
about that.
I love intraoral work, and I love pelvis.
Interoral
Those are
work and pelvis. Okay.
yes, I love a pelvis. Like I will go grab a pelvis from the next room for you. I have props.
So tell us about interoral work. Because I've been doing
Intraoral
it.
work is
Yeah.
it's pretty fascinating in my book. So we talk and chew all the time, but we don't even think about how much our mouth is moving. You know, we talk about how the tongue is the strongest muscle in our body, but yet and still we don't get any work in our mouths and we're moving them constantly. So whether we're swallowing, whether whether we're chewing or whether we're talking, and right now in COVID, can we talk about how the darn masks are pulling our ears? You know, and we're also enunciating more. So that inner aura work, it works with the first two cervical vertebrae, which are about here. And it works with the floor of your mouth. It's great for TMJ, migraine headaches. You know, you'll have sometimes you'll have radiating pain going down your upper shoulders and your neck.
How do you do it? Teach us how to do it. I love it.
Guess who has a glove right here?
That's right. That's just a pelvic school. Don't make her go get it. Okay.
Yeah, don't make me go get my pelvis. I will. Her name is Petunia.
Okay, we'll see Petunia in a minute.
So this is a wonderful, this is a really neat trick. And I also teach my clients to do this while going to the dentist. So let's see, right about here. If you just rub in there and open and part your lips slightly, you'll feel a little something in there, and just give that a little roll. And it actually feels really, really good.
It does. I've been doing it. It does feel good.
Yeah. And make sure you do the other side, even out. And this is, I have to admit, for a lot of people, this is a love-hate work. They're like, Enid, why you want to stick your fingers in my mouth again? Why? Mm-hmm. I'm like, because your neck issue isn't resolved, and it's got to do with your jaw, and it's adjacent to the to the SEM. So,
God, it's so relaxing. It is.
Thumb and forefinger.
Okay.
Stick it in your mouth and stick it all the way to the back. And as you push out against your cheek, so you push out against your cheek, and you're going to feel a muscle up and down. Mm-hmm. There is a fascinating world inside of your mouth. I promise you. That little drawbridge muscle, that is bay. That is bay, especially like when you're getting dental work and you have to hold your mouth open. So, I forgot. Teeth clenching and grinding is also it. How up and down, and just up and down.
Okay.
Push out. You can go 2 fingers and rub around. Mm-hmm. And I kid you not, that helps so many people. I just had a client who came in off the road, and I had to teach him how to do it, and he did not want to do it. I was like, evidently, you're going to still keep on getting that migraine. So you go to the other side, and you can just change fingers, or you can just turn your wrist. And
okay.
And you'll feel some tightness back there. And it's okay.
Okay.
We just don't pay our mouths enough attention.
Okay. I tell you, you taught me that trick about a week or so ago, and I've been not doing it every day, but doing it, and I don't grind as much at night anymore. And I find I can without a mouth guard. See? Yeah.
No, you can't. You put the mouth guard in.
I know, I do. I do anyway. But it's like I can. I accidentally did it the other night, and I wasn't grinding. So it's like, okay. So yeah, it does work. And it feels so good when you do it. It's like you just feel all the tension just leave in this part. So thank you for that tip. That was wonderful. Mm-hmm. So that is a good thing. And let's talk about this pelvis massage we need, or manipulation is the word for it.
So I'm always mixing blended techniques. You really have to get somebody that specializes. Okay. A lot of if you want to find somebody in your area that does good pelvic work, you can look for a neuromuscular training, somebody who does neuromuscular training, especially, and ask them if they've had like the torso and pelvis class. and also for someone, and also look for someone who on Dr. Barral's, on the Barral Institute site,
Okay.
Who's had visceral manipulation 3. It'll be abbreviated VM3.
Okay.
So the VM3 is the pelvic class with the pelvic organs.
Fantastic. Okay. So now, my next question is, I know you love to help people, and that's really good, but what are some of the other reasons you love this work?
I really just love the body. I always have. Um, I have to tell you, I do what I love to do all day, and it's like instant gratification to see people move, to see people get the quality of their lives improved.
Okay.
It is extraordinary.
Just extraordinary. Okay. That's
Yeah.
fantastic. Just to see the body uh move when it's wonderful. It's like a concert to watch the body
Mhm.
move. It's pretty cool.
And I also have to say too that spiritually, if I can say it's also kind of a spiritual reason behind it for me too.
Okay.
So the scripture that talks about how Jesus came alongside his father to become a master worker,
Okay.
I just got caught up in wondering, what is it to be a master worker? What
Okay.
is it just to do that to the full?
Cool. So what has the answer been for you so far?
I'm still mastering. My favorite quote is, form good habits and make them your masters.
Oh God. See there I am learning. I love that quote.
Yeah. And people get upset sometimes when they hear the word master, but can we talk about, rest in peace, Prince?
Okay.
Prince told the artist, get your masters. Get your masters. Because people try to make copies from a copy. But when you make it from the master template, it's extraordinary. So sitting at the feet of masters.
So should our next question is, should people experiment or try different healing modalities? You know, sometimes people get stuck. They only do like typical massages or body work or
Mhm.
acupuncture. So should they go between the
Absolutely.
massage and the body work and the energy work? And then you can tell us what the difference is.
Mm. It is doing a multi-layered approach to your healing always works. You know, it is just so many different body works out there, and you never know what works for you. You know, don't knock it until you try it. Like visceral manipulation, you wouldn't think that sometimes you may have a ligament on a lower bowel organ that or lower intestine, and then once you release it, all of a sudden somebody's leg is moving.
Oh, wow.
Yeah, so it's pretty extraordinary. You may not think with doing craniosacral, even though it's very subtle, you know, you have some people that there are stories of people not needing their hearing aids after doing craniosacral work for a certain amount of time. I had um I had a class, actually, it's my sports massage class, where the instructor was so aggressive, he knocked my top cervical vertebra off his atlas. And fortunately, my mentor was able to get me in, who does craniosacral. God bless Mabel Sharp. And she actually got it back on track for me, and it was super gentle. I'm always like, go see a chiropractor, go see a massage therapist, get some acupuncture, get some visceral manipulation, get some Reiki, get some pranic healing. Forgive me if I'm missing anything. Like it all ties in together. Get some rolfing, even though rolfing is rough, it's okay. It is a very good structural integration. I have a good friend who is a rolfer, and I'm a former golfer, and my SI joint swung for years, but that rolfing did the rolfing, and it never and I never had another problem.
Okay, so how often should someone get body work or any healing modality? What's the regularity you would recommend?
Ooh. Well, if you don't do anything else, I say get body work seasonally.
Okay.
So, you know, I definitely recommend massage every other week to a month. Don't go without a month.
Okay.
If you're doing things for wellness, you can go longer. So, like, for doing and if they're like specialty modalities, you may be able to go a little bit longer, but there are several ways to approach things. Like, I do cupping. I do cupping for different reasons. Sometimes I'm doing it for lymphatic drainage. Sometimes I'm doing it for fascial release, because I do the web cupping. That's massage cupping. Um, when you do acupuncture, which is energetic and it works with the meridians, you may have to do it more frequently. I am diagnosed with a bleeding disorder, and I find that when I'm doing acupuncture, I actually bleed a little bit less. So that's that's another thing. So how often are you doing the treatments? You can actually do acupuncture in a scar. So acupuncture can help release a stubborn scar, even though there is hand work for scar mobilization. So it just really depends on what you got going on and what type of warrior are you. Are you an office warrior? Meaning, are you sitting in that chair all the time? Are you a weekend warrior, meaning that you're going on 20-mile bike rides? It just depends on your lifestyle. But I say at the very least, every season, try something new. And then also get on a regular schedule, because if you're not regular with your practitioners, they don't know your body. So when you come in with an emergency, you're starting from ground zero. So it just varies, because actually, technically, you can do massage and some of these other modalities every day.
So after a healing session, what does your patient usually experience? So after a session, what should people expect?
Oh, goodness. So many different comments about what happens. Um, Generally, I would say, like, just doing regular integrated massage, which I normally am using neuromuscular training to integrate, and doing traditional Swedish therapies and adding some other things in possibly. A lot of times people get off the table feeling lighter because their muscles are moving in concert much better. So that's one thing. Um, I don't have people too often sore, because I believe that deep is a level and not a pressure. And so pain is a symptom. So for me, if I find something painful, that doesn't mean dig in there. It means to ease with the body and get in there and communicate with the body. So a lot of times people are lighter, or leave pain free, or way decreased. Mobilization, like they're moving a lot better. Um, Sometimes people are farting and belching on the table because the peristalsis has increased, or the movement of their organs, you know. So it is something. And some people, depending upon what you came in for, and that's the thing, what are you coming in for? I done had some poor babies in here in the most wonderful way. And I call them baby because they're spirits, they're babies. Sometimes they don't know, and they leave, and they get ready to leave, and they're staying in my chill out room for a minute because they're not ready to drive home. I've had people during Valentine's Day. I literally had people spinning out of my room. Literally, they were so happy, just spinning and hugging themselves. Just I can't even tell you, but it's fun.
So, when someone has I guess a serious issue, how many sessions has it taken you to correct that?
That takes quite a while. But when you're in like a clinic mode, you may see your therapist 2 to 3 times a week. So that's the clinic mode, because you have to break the pattern in the body.
Okay.
So body's like it's called a facilitated pathway. So it's going to keep on going into that that pattern of ease. And so you want to stop, you want to break that pattern and not keep on overshooting that pain threshold. You want to bring it down and bring it down gradually.
Okay.
Or we need to get you into a mode where you're moving, and all the work is cumulative.
And do you use your own energy when you're doing this work? And if you do, how do you replace your energy?
Kind of, sort of. I am always grounding, so I always make sure I pull my energy from the ground.
Okay.
Like a boxer is supposed to pull their punch from the ground. I literally am pulling from the ground at all times. But also, I will do things like go out in nature. I will replenish. You know, fortunately, my office is by a river. So I'll literally go outside, I'll take a walk. You have to do that. Self care is big, because if I don't care for myself, I cannot care for others. So, how your therapist cares for themselves is how they care for you.
Oh, okay. That's another technique to use to see if you've got the right therapist. So if they look tired and look like they need a rest, it's like that's not the therapist for you. So
Mhm. I will
uh,
power nap in between your massages.
okay, all right. So we know that your technology is giving you a signal. So is there anything that you'd like to leave us with so we can wrap up? We don't want anything to happen to you.
I really want you to look at getting your body work. A lot of times people put body work last on their list, and use it as an investment, because remember, your body is a tool, whether you admit to it or not. So whether you're whether you're typing, whether you're hammering, whatever it is, body work is always the best support work at all times. So just keep that in mind. And so, and massage and energy work, all the body work is going to be a support work to everything. And talk to your therapist. Your therapist can work with whatever your goals are. And if they can't, and if they aren't, find the next one. And they can even work with some of your medical goals a lot of times. But
That's
that's always finding the correct therapist for the job.
that's fantastic. Well,
Oh, and I want to encourage I want to
okay.
encourage the desk warriors to do something.
Uh-huh.
Please stretch the front of your neck. I'm seeing everybody stretch forward like this,
Right.
but going back and raising your arms above your head a couple of times a day
Yep.
does wonders for your neck. And bending forward back,
And
you know.
I've been doing that too. So
Yeah.
I have been practicing that. So
Yeah. So all of that makes a difference.
I want to thank Enid. It's her electronics have actually ran into a little bit of difficulty, so we're going to go ahead and end the show. I want to thank Enid for joining me tonight, and I want to remind you to do not go gently into that good night. Find a hill worth dying for and take it and be the person you're waiting for. Make today so awesome that yesterday gets jealous, and above all else, do it your way. I'm Stephanie Wilson-Coleman, the Empowerment Doctor, and I want to remind you that life is too short to drink cheap champagne. Be inspired until further notice and celebrate everything. Good night, and you guys have a great evening.
Relax and imagine your perfect life. If what you're imagining isn't the life you're living right now, then you need to experience Stephanie Wilson-Coleman. A victim of abuse and poverty, Stephanie overcame the odds to rise to success. Make the decision to allow Stephanie to help you move forward to your success through her books and empowerment tools, available at champagneconnection.com, where you can dream big.
But life's too short to drink cheap champagne, so I decided to buy me a better brand to taste with my